Good afternoon. Tuesday, November 19, 2024. I'm Dr. Deuk, just a month or so away from a new year. Our patient is having horrible neck pain. She's had a car accident. The car accident happened in California. She is from California. She traveled here for this procedure. We're also going to be treating her sacroiliac joints, which will be next, but we're going to start with fixing her neck pain. Now, her pain is on the left side of her neck. When she rotates her head to the left, she gets pain. Is that where you were? Right there, the X?
Yes.
We're going to start by numbing up her skin. She's asleep. We're going to give her a little numbing medicine, and then we're going to get started with the procedure. She has facet joint pain. Facet joint pain does not go away on its own. It usually requires treatment. The best treatment in the world is the Deuk plasma rhizotomy. We're about to do that procedure right now. If you have questions, feel free to type them up. In the meantime, we're going to get started. The goal of this surgery is to go in and destroy pain nerves that are responsible for causing pain. It's a very simple concept. There are little nerves. They run in the back of your neck and in the back of your lower back. And these nerves have one job: to take pain signals up to your brain. Shot. All right, you can see the tip of our probe is heading right for the spine. There we go. Shot. And we're going to be a little bit lower than that, but that is pretty darn close to where we want to be. If you have questions, type them up. I'll answer them for you.
At this moment, no current questions.
Thank you. Why don't we show the audience while we're doing this then exactly how this procedure works. And more importantly, why do people get facet joint pain? What's the mechanism of injury?
Copy that.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Welcome back. You can see from our video that the problem with these facet joints, folks, is that people get really bad arthritis in the joint, and nothing takes that arthritis away, but you can take the pain away, and that requires what we're doing right now. It's called the Deuk plasma rhizotomy, destroying pain nerves that are innervating the joint. We got just a couple more and we're going to be done. Her problem is that she has bad arthritis, but she also has bad osteoporosis. So the bone quality is not great. You can see on the x-ray that the bone is faint. It's not nice and dark. And the reason it's faint is because she has a loss of what's called bone mineral density, bone mineralization. And that, unfortunately, thin, weak bones that are easy to fracture. All right, just about done with her neck. We're going to move on to the SI joints. Any questions?
Yes, we have a question coming from Raj on YouTube
Hello, Raj. Welcome.
asking, Doctor, how do people injure their facet joint? Is the acute injury very painful?
Yeah. Yeah, Raj. They injure their facet joint the same way they injure their disc. As a matter of fact, the injury to the facet joint happens at the same time the injury to the disc happens. It's trauma. Trauma. Is she awake? Was she just talking or no? That was somebody else? My nurse? I was going to say, if she's awake, she's not going to be happy about this because it's painful. All right. Trauma. Raj, trauma. Trauma is the source. We're done. We're going to move on to the SI joints. Trauma. So car accident. In her case, car accident, whiplash. The head gets snapped, and when that head gets snapped, it's putting tremendous force on the joints, like the disc and the facet joints. Luis, here you go. And that tears the capsule, the facet capsule. All right, we'll be back in a short time with our bilateral sacroiliac joint Deuk plasma rhizotomy.